The split stance deadlift is a great exercise, but I feel that we can take it one step further and get a little bit more intentional with our coaching. The movement can actually be powerfully used to not only improve strength, but to increase range of motion. So in this video, I want to discuss why we should prescribe a split stance deadlift, the biomechanics behind it, and how to properly execute it. So instead of blindly prescribing a split stance deadlift, let's get a little bit more intentional so we can get more out of the movement. Now, in order to improve range of motion and strength at the same time, we need to start with our assessment. Our assessment is what's going to carry over and actually guide our treatments, our plan of cares, our workouts, so that it's really specific to our patient or client. Now, when it comes to the assessment, we're going to look at a few key exercises that are really going to help us understand which side we should bias when we're performing a split stance deadlift. The two key exercises are hip external and hip internal rotation. Typically, as we go through our assessment and look at these measurements, what we're going to find is that the left side usually has more external rotation, but less internal rotation, compared to the right side where we typically see more hip internal rotation and less hip external rotation. Now, to understand the why behind that, let's actually dive a little bit deeper into the pelvis biomechanics so then we can maximize how we coach and execute the split stance deadlift. So we have our table measurements. We found that there is a loss of internal rotation on the left compared to the right. And the next thing we need to do is understand the biomechanics, but before we can do that, we really need to start to look at that this is the symptom and this is the source. What I mean is that, yes, the internal rotation is limited on the left, but you then need to ask yourself, is it actually limited or is it in a position that's causing it to be limited? For example, when we look at the pelvis and the human body as a whole, there's a natural tendency to be turned towards the right. The response that this is going to give is an increase in internal rotation at this femur and an increase of external rotation at this femur. Now, this happens because when we have this natural asymmetrical bias, when we're turned to the right, we are going to have a right acetabulum that is more anteverted and a left acetabulum that is more retroverted. What that's going to do is start to slacken the iliofemoral ligament. If you think of that ligament and compare it to a towel, when you're in external rotation and you are this way, it actually tautens or tightens the towel. Conversely, when you move towards that side, we're moving into internal rotation on this side, it actually unrings the towel and loosens and puts slack throughout that ligament. This is one of the reasons, coupled with the anteverted acetabulum, that's going to improve the ability to internally rotate the hip. So all that being said, this left side's not actually tight. It's just in a position that is causing it to be tight. So what we want to do is improve the foundation of this pelvis and work on getting it to go back to the left. This is going to help the person in front of you reciprocate, i.e. walk better, i.e. breathe better, i.e. perform better, i.e. get their range of motion better. The reciprocation and restoration of a normal pelvis is going to loosen this left side so you can improve their range of motion. Then we throw our split stance deadlift on top of it and start increasing their strength with the newfound range of motion. Now we need to understand, what does the split stance deadlift actually do to improve this motion, and why do we actually increase range of motion while building strength with that exercise? To understand that better, all we need to do is to flip the pelvis around and recognize compression and expansion that happens in that pattern. So we already said that the normal pattern is that we are turning towards the right. Now, what I want you to do to really simplify this is understand that muscle back here is going to be compressed and going to push the pelvis towards that side. Now, if the muscle is tight and compressed and in a concentric bias position, it's not going to want to expand, move eccentrically, lengthen. So we have compression on this right side of the back pelvis coupled with expansion on the right side. And you can see the space back here open up. That openness is because the muscles are allowing that expansion to occur, right? When we're thinking muscles, we're thinking glutes, piriformis, these posterior pelvis muscles. So the split stance deadlift is going to work on giving the patient or client what they don't have. If we said that our normal position is compressed on the left and expanded on the right, we are going to try to do the opposite and expand the left. As we go through our split stance deadlift, we are working on compressing the right side while expanding the left. The nice thing is, as we're continuing through this, we're bringing all of these posterior pelvis muscles that are used to being compressed and concentrically biased through an eccentric lengthening phase. Over time, this is what's going to start to restore the patient or client's ability to be a little bit more symmetrical and a little bit more reciprocal compared to only being stuck on the right side. So we really talked about everything: the assessment, the source versus the symptom, the biomechanics of the asymmetries that we have, and even the biomechanics of the split stance deadlift. Now let's talk about how to actually execute it. Now remember, we are specifically doing this to improve range of motion and strength. So we are using our assessment to guide us. And that assessment showed us that the pelvis is turning to the right and that patient or client has a difficult time shifting to the left. So we're not going to do this on both sides. We're actually only doing it on the left side. So keep that in mind and think about what's going on biomechanically at the pelvis as I'm going through this. And what is my why? My why is that I'm trying to expand the posterior lower pelvis, and I'm trying to compress the right side of that posterior lower pelvis. The setup for a split stance deadlift, I always like to use a slant board. What the slant board does is it helps to increase dorsiflexion, which is going to allow you to capture a little bit more pronation and internal rotation through the slant board leg. You're going to want to put the left foot and the left toes on and the right foot in front. Notice what I'm doing just by the setup. The right side's forward, the left side's back. That is getting us already in a turned position. As we grab our kettlebell, you don't need a kettlebell or a dumbbell. You can do this with body weight. We're thinking about that this kettlebell, the dumbbell, or your hand, if you're not holding something, is going towards the big toe. And from here, the knee will be slightly bent on the right, the left side unlocked, not super bent, just unlocked. I like to reach this right hand back. We're going to reach back. As I push that left hip back, my right knee is going forward and I'm getting that turn. I feel a nice burn through this back pocket area. The back pocket is an easy cue instead of saying posterior lower pelvis for the patient or client. So as we go through it, that left knee really doesn't move, right? It stays unlocked. How I'm achieving this motion is by pushing that hip back and pushing that right knee forward. So I'm really going through a nice turn. And as I'm turning, I'm searching and finding that left back pocket area, which is indicative of that eccentric or that lengthening occurring where we want it to.